Hello everyone, welcome back to my channel, and for those who are visiting it for the first time, welcome to my channel. This is Bhavya Sharma here with you, and we people are going to talk about the bone anatomy, that is of the humerus bone. We have already studied the site determination in a video, and in the second part, that is in the another video, we have talked about the features of the humerus bone. And as I told you, in the next part, that is the third part, that is this video, we would be talking about the muscle attachments, and also we would be talking about the clinical anatomy of the humerus bone. So without any delay, let's get into the video. How we are going to study the muscle attachments? We are first going to go through the insertions, that is all those blue marked muscles. I already told you that insertions are marked or colored with blue. Then we would be talking about the originating muscles from the humerus bone, and then we would go through the ligaments of the ligaments that are related to or that are attached to the humerus bone. And the second thing that I wanted to share with you people was, how did I color this bone? What did I use is these three things. These are actually whiteboard markers which I brought for my seminar. I had a seminar in my college and I was supposed to write and explain and all that. So I bought these whiteboard markers and I used these on the bone. But what is the disadvantage of this is, this will get erased. You can use paint colors which are waterproof. Otherwise you can use markers. Yeah, so you can use color markers, but not the whiteboard ones. You have to use the permanent markers. And now we are going to go through the video and we are going to go and read about the muscle attachments and the clinical anatomy. So, starting with the upper end, in the lesser tubercle, the subscapularis muscle gets attached. In the greater tubercle, you have three muscles getting inserted in three impressions, that is the uppermost impression, the middle impression, and the lowermost impression. So, in the uppermost impression, you have the supraspinatus muscle getting attached. In the middle impression, you have the infraspinatus muscle getting attached. And in the lower impression, you have the teres minor getting attached. Now let's talk about the intertubercular sulcus, that is the sulcus around here, and which is also known as the bicipital groove, and also about the lateral lip and the medial lip of the intertubercular sulcus. So for this you can learn it as a mnemonic called lady between two majors. Again, lady between two majors. So L for latissimus dorsi, that is the lady which will be attached in the intertubercular sulcus floor, that is latissimus dorsi. Again, the latissimus dorsi muscle, that is L for lady, would be inserted or attached in the intertubercular sulcus and would be between the two majors. Okay, so in the medial side, you will have the teres major, and in the lateral side, you will have the pectoralis major. So, lady between the two majors. Latissimus dorsi in the intertubercular sulcus floor, and the teres major on the medial side, the pectoralis major on the lateral side. Also, many of the times they can also ask you what are the contents of the intertubercular sulcus. There are totally two contents of the intertubercular sulcus. The one is tendon and the another one is an artery. So the tendon is, I've already told in the feature video also, the tendon of long head of biceps brachii, and the artery is the ascending branch of the anterior circumflex artery. Saying it again, the artery is the ascending branch of the anterior circumflex artery, and the tendon is the long head of biceps brachii tendon. And then the last two muscles that insert into the humerus are the deltoid, that is the deltoid muscle in the deltoid tuberosity, which we saw in the features, and also in the medial side. See, the medial side, in the medial side on the rough surface, you have the insertion of the coracobrachialis. Okay, so before going into the originations, we will just revise it once more. We will revise all the insertions one more time. In the lesser tubercle, you would have the subscapularis muscle inserting. In the greater tubercle, you will have three muscles inserting. In the uppermost impression, you would have the supraspinatus getting inserted. In the middle impression, you would have the infraspinatus getting inserted. And in the lowermost impression, you will have the teres minor getting inserted. And then, looking at the intertubercular sulcus and the two lips of the intertubercular sulcus, you will use the mnemonic called lady between the two majors. L for lady goes for latissimus dorsi, which gets inserted into the floor of the intertubercular sulcus. And on the medial side, you will have the teres major, and on the lateral side, you would have the pectoralis major. Also, talking about the contents of the intertubercular sulcus, you would have the long head of biceps brachii tendon, and also you would have the ascending branch of the anterior circumflex artery. Now, talking about the other two muscle insertions, you will have the deltoid insertion in the deltoid tuberosity, and you will have the coracobrachialis insertion in the medial side rough surface. So this is all about the muscles inserting into the humerus bone, and now we will go through the muscles that get originated from the humerus bone. So the first origin that we see here would be the brachialis from the lower half of the shaft of the humerus, that is origination from the anteromedial and anterolateral aspect of the humerus. Again, I said that there will be origination of the brachialis muscle from the lower half of the shaft of the humerus. The surfaces that it would be originating from would be the anteromedial surface, this is the medial side, so anteromedial surface, and the anterolateral surface. Now let us talk about the origins from the lateral supracondylar ridge and the medial supracondylar ridge. As we studied in the features, we have two ridges in the humerus lower part, that is the lateral supracondylar ridge, this one, and the medial supracondylar ridge. So, when we see the lateral supracondylar ridge, two muscles get originated from that. From the upper two-thirds of the lateral supracondylar ridge, we have the brachioradialis muscle getting originated, and from the lower one-thirds of the lateral supracondylar ridge, we have the extensor carpi radialis longus muscle getting inserted. So, two muscles, that is from the upper two-thirds, we have the brachioradialis muscle origination, and from the lower one-thirds, we have the extensor carpi radialis longus muscle getting originated. Now, this is the medial supracondylar ridge. Let us have a closer view. So, from the medial supracondylar ridge, we have the pronator teres, that is this one. The pronator teres muscle getting originated from the lower one-thirds of the medial supracondylar ridge. So that is all about the origination from the ridges of the humerus bone. Now, talking about the medial and lateral epicondyles, we have the extensors and flexor origins from each of the epicondyles. So, how I learned that is using the mnemonic FM. So, F goes for flexor origins and M is for medial epicondyle. So, according to the mnemonic, the medial epicondyle gives origin to the flexor muscles, and then opposite goes for the lateral epicondyle, that is, it gives origin to the extensor muscles. Now we are done with the attachments in the anterior aspect of the humerus, and now we will be going to the posterior surface of the humerus. As we saw in the features video, we have the radial groove in the posterior surface, above which, that is on the oblique ridge, we would have the origin of the lateral head of triceps brachii. Repeating again, in the oblique ridge above the radial groove, we would have the origin of the lateral head of the triceps brachii. And the other muscle that gets originated from here would be the medial head of the triceps brachii. See, the long head gets originated from the scapula bone. We have already completed that one. So the other two heads, that is the lateral head, originates from the oblique ridge above the radial groove, and the medial head originates from the posterior aspect below the radial groove. So above the radial groove you have the lateral head, and below the radial groove you have the medial head of the triceps brachii. So the last muscle that we would be observing would be the anconeus, that is present in the posterior aspect of the lateral epicondyle. So that is all about the origins of the muscle from the humerus bone. And now we would go through the two ligaments that are present or attached in the humerus bone. The first ligament that we see here is the capsular ligament that would be attached in the anatomical neck of the humerus. The capsular ligament is the ligament of the shoulder joint which would be inserted into the or attached into the anatomical neck of the humerus. Sorry for the inconvenience, but the bone is a little bit broken and I have to buy a new bone of humerus. Then next coming we have the capsular ligament of the elbow joint that would be present in the curve, or that would be attached in the curve of these two fossas, that is the coronoid and radial fossa anteriorly, and would also be attached posteriorly in the curve above the olecranon fossa. Now we are totally done with the attachments of the muscles that get inserted, the muscles that get originated, and the ligaments that get inserted into the humerus bone. And now the very important question that many times has been asked in my viva or practical exams or theory exams also is the nerves related to the humerus bone. So there are three nerves that are related closely to the humerus bone. The first one is your axillary nerve, which is present at the surgical neck of the humerus. This one, the surgical neck of the humerus. Second nerve related closely to the humerus is the radial nerve present in the radial groove. That is why the groove is named as the radial groove. And the third one that we observe is the ulnar nerve that winds around or that comes from behind the medial epicondyle. So that is all about the three nerves that are closely related to the humerus bone. One is the axillary nerve in the surgical neck. The another one is the radial nerve at the radial groove. The third one is the ulnar nerve from the medial epicondyle or behind the medial epicondyle. So that is all about the nerves closely related to the humerus. And now we are going to go through the clinical anatomy of the humerus bone. So in the clinical anatomy, we would see two things, that is, one would be the fracture of the humerus bone and another one is the dislocation of the humerus bone. So first, talking about the fractures, we have three common sites of fractures, that is the surgical neck, that is this one, the supracondylar region and the shaft of the humerus. In the supracondylar fracture, the cause is falling on an outstretched hand. It can cause you two damages mainly, that is, it can cause the damage of the median nerve or injury or lesion to the median nerve, and it can also cause occlusion of the brachial artery. And because of that, there is a contracture which is known as the Volkmann's ischemic contracture. By occlusion of the brachial artery, I mean the blockage of the brachial artery, so that the blood will not flow from the brachial artery because the brachial artery would be blocked. So repeating again, the two major damages that are caused due to supracondylar fracture is injury or lesion to the median nerve, and second, it can cause occlusion or blockage of the brachial artery, which causes a contracture which is known as the Volkmann's ischemic contracture. Now, talking about the dislocations of the humerus, the most common dislocation of the humerus is anteriorly and inferiorly. That is, the humerus mostly dislocates antero-inferiorly. Hey guys, that is the end of the Humerus Bone Anatomy series videos. We are done with the Humerus Bone Anatomy as well. Here we have studied the site determination in the first part video, and we have gone through the features of the humerus bone in the second part of the video. And in the third part video, we have gone through the muscle attachments and the clinical anatomy of the humerus bone. If there is any doubts or any queries, please comment down in the comment section below. Also, if you want me to make any topic very soon before other topics, please let me know that also in the comment section below. The notes would be uploaded in my Insta page for the humerus bone. Please go and check that out. And also, I have started uploading easy diagrams, label diagrams that can make you remember certain topics easily, which are very important. So keep following my page for that as well. I'm going to upload the notes of this as soon as possible. Please do check out for the notes of the Humerus Bone Anatomy. The link for my Insta page would be there in the description. And as always, like, share, subscribe, and keep supporting. Your support is all I need. I hope this video was helpful. And until the next video, stay safe, stay home.